PPR in sheep and goat. PPR in sheep and goat. Pest des petits ruminants PPR, also known as sheep and goat plague, is a highly contagious animal disease affecting domestic and wild small ruminants. It is caused by a virus belonging to the genus Morbillivirus, family Paramyxoviridae. What are the symptoms of PPR? Clinical findings. The acute form of PPR is accompanied by a sudden rise in body temperature to 40 degrees minus 41.3 degrees Celsius, 104 degrees minus 106 degrees Fahrenheit. Affected animals appear ill and restless and have a dull coat, dry muzzle, congested mucous membranes, and depressed appetite. How can you prevent PPR? As a result, PPR can now be controlled by focused vaccinations in high-risk populations of sheep and goats, followed by mass vaccination campaigns. Mass vaccination campaigns must achieve high levels of herd immunity, 70% to 80%, to block the epidemic cycle of the virus. How is PPR spread? The main route of infection is respiratory, and PPR is spread by airborne droplets. All secretions and excretions of infected animals are contagious throughout the course of the disease, but no carrier state exists. The virus targets lymphoid tissue. How do you treat PPR in goats? No specific treatment is recommended for PPR being viral disease. However, mortality rates can be reduced by the use of drugs that control the bacterial and parasitic complications. Specifically, oxytetracycline and chlortetracycline are recommended to prevent secondary pulmonary infections. What is treatment of PPR? Abstract. Clinical cases of Pest des petits ruminants (PPR) disease in goats were treated symptomatically. Broad-spectrum antibiotics, intestinal sedatives and fluid therapy were used for the treatment of pneumonia, diarrhea and the restoration of the body fluid ionic balance. What is PPR vaccine? Pest des petits ruminants PPR vaccine. Description. Lyophilized virus vaccine. PPR virus strain cultured on Vero cells. Freeze. Dried vaccine with a minimum titer of 2.5 TCID